Hello and welcome to News Pulse. I'm Esther. Ashraya Hasta Trust, in collaboration with Mantra and Surya Foundation, donated 5 oxygenated beds and introduced the latest medical technology in catering to rural health care at Primary Health Center CHEN in MON district of Nagaland. These facilities will help one of the remotest people living along the stretches of the Indo-Myanmar international border. The PHC is strategically located so that healthcare is extended to patients within the vicinity and the neighboring areas. Otherwise, the nearest healthcare facility would be 30 to 40 kilometers to MON District Hospital or Aboy Community Health Center.
Hello, hi, myself Puneet. So we are from an organization called Mantra and Surya Foundation. We are into COVID response where we have set up oxygenated beds, provided ambulances, provided governments with critical medical equipments with the support of various donors. And we are here in Nagaland to oxygenate PHCs, and this is our second intervention. Earlier in July we had done an intervention where we set up 5 oxygenated beds in the remote primary health center of Moniakshu. And again, with working with the district administration, we are here to set up oxygenated beds. So the primary health center which we are setting up is supported by Ashraya Hasta Trust, which is founded by K. Dinesh, who is the co-founder of Infosys and his family. We are providing medical consumables, oxygen concentrators, Fowler beds, and other critical medical consumables such as like PPE kits, N95 masks, gloves. So the idea is to kind of equip a full-fledged oxygen support center so that if any people need critical care or intervention, they can be provided at the PHC itself. That will help or avoid people coming from from the remote locations to the main district looking out for oxygen support. This entire initiative has been supported by Indian Army and of course our Tavasilan sir, Tavasilan is the IAS and Deputy Commissioner of MON, and we are a team of 6 volunteers, and we look forward to kind of support more such initiatives in Nagaland and especially in Northeast region of the country. Thank you.
To speak more on this, we have the Deputy Commissioner of MON, Tavasilan K, over the phone. Hello, sir. It's a pleasure to have you on our show.
Good evening, Ms. Esther.
Hello, sir.
Thank you for having me on the show.
Yes, sir. First of all, sir, can you shed some light on the NGOs and how did the connection happen with the MON District Administration?
Sure. So we've been working with Mantra and Surya Foundation in terms of upgrading our healthcare infrastructure over and above what the government is already doing. There are several of these foundations which are helping augment the healthcare infrastructure across the country during COVID-19 pandemic, and sort of this would help the healthcare even beyond COVID-19. Okay. So this time, Ashraya Hasta Trust. So Mantra and Surya Foundation have already, set up oxygenated beds at PHC Moniakshu. Okay. Which is also one of our remote regions along the Indo-Myanmar border. Okay. This is the second facility that they are setting up in MON district. Okay. Last time it was the Shibulal Foundation. Mr. Shibulal is one of the founders of Infosys. Mm-hmm. This time it's the Ashraya Hasta Trust, which is also a foundation that's run by one of the other founders of Infosys, Mr. K. Dinesh. So they've been sort of sponsoring this initiative and helping us set up oxygenated beds along with a whole lot of equipment and strengthen healthcare infrastructure in Moniakshu and CHEN.
Mm-hmm. Sir, how many oxygen beds did MON have before this NGOs came and set up these beds? How many did MON exactly have?
So, if you look at oxygenated beds, the health units already had 4 to 5 beds on an average in the PHCs. So along with oxygen cylinders. Mm-hmm. Now the state government has also been providing oxygen concentrators, which have been distributed right till the level of primary health centers and community health centers. Okay. Now this initiative is helping us further by increasing the availability of the number of oxygen concentrators, along with these extremely good semi-Fowler beds that have been provided by the Ashraya Hasta Trust, along with a whole host of other equipment that they're giving. So on an average, each of these health units had about 5 beds with oxygen cylinders, Now, after COVID-19, the state government has also been providing oxygen concentrators. Now, the trust have also provided oxygen concentrators, so that, you know, the total number has gone up to about 10 oxygen concentrators at each of these health units, in addition to oxygen cylinders provided by the state government as well as the trust. They've given 5 oxygen cylinders to each of the locations.
Okay, considering that there are, you know, not much of O2 plants in the state, how is the district planning to refill these cylinders and make use of it over and over again?
So we've been working with the central government under its PM CARES plant, and the PM CARES scheme has donated a 500 litre per minute oxygen generation plant, which will be installed at the district hospital. We're also working with an organization called ACT Grant, who have already provided a 400 litre per minute oxygen generation plant, which has been installed at the district hospital.
Right.
And in addition, they are also providing something known as a booster. So this booster, it's something that's work in process. We haven't received it yet. Once the booster is installed, we don't have to go down to Shivsagar. So as of now, as we speak, we have to go and take our cylinders to Shivsagar, where there is a oxygen refilling plant, where we fill it up and then we bring it back, and then we further distribute it to all the health units. Now, with this booster unit, which is under process, once it is installed, we can refill all our cylinders right at the district hospital itself, and we don't have to go to Shivsagar anymore.
So how many villages will be benefiting from this initiative? I mean, it is not just going to benefit Nagas, but also beyond the borders, you know. So how many do you think will be benefited from this initiative?
So we have, I mean, if you look at CHEN area, the PHC CHEN caters to about 12 to 15 villages. And, you know, since we share the international border with Myanmar, several times people apply for the free movement regime, they take a pass, and then they come over to MON for their medical needs as well. So we presume that this will also sort of help villages, inhabitants of villages across the border. Should there be a medical emergency, they can come and take help after applying for the passes, and come over and take help in CHEN as well. So we won't be able to give you a specific number, but then it would benefit a lot of villages within Nagaland and inhabitants across the border.
Okay, sir. On that note, how is the COVID situation in MON right now?
Right now it's under control, God's grace. We've not had a surge in the past several months. So right now we don't have any active cases. We're constantly testing as many people as possible, and to give us an actual sense of what the spread could be. But then we are on complete alert, and the third wave or any number of waves that might come in the future. We're trying to ensure that we're prepared enough to mitigate anything that might happen.
Okay, sir. And also, just yesterday, the centre has told the Supreme Court to give ex gratia of 50,000 rupees to, to COVID death, the kin of the COVID death patients. And so, is your administration also planning to have this initiated very soon?
So the state government would be taking a call for the whole state, depending on directives from the central government. So I think we're waiting for that information to come in.
Okay.
And then I think we'll go ahead and get it implemented in accordance with the directives of the state government.
Okay, sir. Okay, thank you so much, sir, for speaking with us.
Thank you so much.
Thank you.